Linking on my brain. Okay. Linking on my brain. I got linking on my brain. Whoa.
Axilla Introduction. The axilla, Latin armpit, is a pyramidal space situated between the upper part of the arm and the chest wall. It resembles a four-sided pyramid, and has the following: I an apex, 2 a base, 3 4 walls, anterior, posterior, medial and lateral. The axilla is disposed obliquely in such a way that the apex is directed upwards and medially towards the root of the neck, and the base is directed downwards. Dissection. Place a rectangular wooden block under the neck and shoulder region of cadaver, Fig 4.1. Ensure that the block supports the body firmly. Abduct the limb at right angles to the trunk, and strap the wrist firmly on block projecting towards your side. In continuation with earlier dissection, reflect the lower skin flap till the posterior axillary fold made up by the subscapularis, teres major and latissimus dorsi muscles is seen. Clean the fat, and remove the lymph nodes and superficial veins to reach depth of the armpit. Identify 2 muscles arising from the tip of the coracoid process of scapula. Out of these, the short head of biceps brachii muscle lies on the lateral side and the coracobrachialis on the medial side. The pectoral muscles with the clavipectoral fascia form anterior boundary of the region. Look for upper 3 intercostal muscles and serratus anterior muscle which make the medial wall of axilla. Clean and identify the axillary vessels. Trace the course of the branches of the axillary artery. Reflect the upper skin flap on the arm till the incision already given at its junction of upper 1/3 and lower 2/3. Apex/cervicoaxillary canal. It is directed upwards and medially towards the root O1 the neck. It is truncated, not pointed, and corresponds to a triangular interval bounded, anteriorly by the posterior surface of clavicle. Posteriorly, by the superior border of the scapula and medial aspect of coracoid process. Medially it is bounded by the outer border of the first rib. This oblique passage is called the cervicoaxillary canal, Figs 4.2a to c. The axillary vessels, axillary vein, and the brachial plexus enter the axilla through this canal, I subscapularis above. 2 teres major. 2 latissimus dorsi below. Medial wall, it is convex laterally and formed by the following: I upper 4 ribs with their intercostals muscles. Upper part of the serratus anterior muscle, Fig 4.5. Lateral wall, it is very narrow because the anterior and posterior walls converge on it. It is formed by the following: upper part of the shaft of the humerus in the region of the bicipital groove, and coracobrachialis and short head of the biceps brachii, Fig 4.5. I contenta of axilla 1 axillary artery and its branches. 2 inelroclavicular part of the brachial plexus. 3 axillary vein and its tributaries. 1-5 groups of axillary lymph nodes and the associated lymphatics point to the cong thoracic and intercostobrachial nerves. 2 axillary fat and areolar tissue in which the other contents are embedded. Layout: 1 axillary artery and the brachial plexus of nerves run from the apex to the base along the lateral wall of the axilla, nearer the anterior wall than the posterior wall. 2 The thoracic branches of the axillary artery lie in contact with the pectoral muscles, the lateral thoracic 3 vessels running along the lower border of the pectoralis minor. The subscapular vessels run along the lower border of the subscapularis. The subscapular nerve and the thoracodorsal nerve, nerve to latissimus dorsi, cross the anterior surface of the subscapularis. The circumflex scapular vessels wind round the lateral border of the scapula. The axillary nerve and the posterior circumflex humeral vessels pass backwards close to the surgical neck of the humerus. The medial wall of axial is avascular except for a few small branches from the superior thoracic artery. The long thoracic nerve, nerve to the serratus anterior, descends on the surface of the muscle. The intercostobrachial nerve pierces the anterosuperior part of the medial wall and crosses the SPA-CES to reach the medial side of the arm. 5. The axillary lymph nodes are 20 to 30 in number, and are arranged in live sets. The anterior group lies along the lower border of the pectoralis minor, on the lateral thoracic vessels. The posterior group lies along the lower margin of the posterior wall along the subscapular vessels. The lateral group lies posteromedial to the axillary vein. D. The central group lies in the fat of the axilla. The apical group lies behind and above the pectoralis minor, medial to the axillary vein. Axillary artery. Axillary artery is the continuation of the subclavian artery. It extends from the outer border of the first rib to the lower border of the teres major muscle, where it continues as the brachial artery. Its direction varies with the position of the arm. The pectoralis minor muscle crosses the artery and divides it into 3 parts, Fig 4.6. 1 fist part superior, proximal, to the muscles. 2 second part posterior, deep, to the muscles. 3rd part inferior, distal, to the muscles. Relations of axillary artery. Relations of first port. Anterior. 1 skin. 2 deep. 3 clavicular part of the pectoralis major. 1 superficial fascia, platysma and supraclavicular nerves. 2 clavipectoral fascia with cephalic vein, lateral pectoral nerve, and thoracoacromial artery. 3 loop of communication between the lateral and medial pectoral nerves. Posterior. 1 first intercostal space with the external intercostal muscle. 2 first and second digitations of the serratus anterior with the nerve to serratus anterior. 3 medial cord of brachial plexus with its medial pectoral branch. Lateral. Lateral and posterior cords of the brachial plexus. Medial. Axillary vein. The first part of the axillary artery is enclosed, together with the brachial plexus, in the axillary sheath, derived from the prevertebral layer of deep cervical fascia. Relations of second port. Anterior. Skin superficial fascia deep fascia. Pectoralis major. Pectoralis minor. Posterior. Posterior cord of brachial plexus subscapularis. Lateral. Lateral cord of brachial plexus. Coracobrachialis. Medial. Medial cord of brachial plexus. Medial pectoral nerve. Axillary vein. Relations of third port anterior. Skin. Superfacial fascia. Deep fascia. 1 in the upper part there are the pectoralis major and the medial root of the median nerve, Fig 4.7c. Posterior. Radial nerve. Axillary nerve in the upper part. Subscapularis. 1 tendons of the latissimus dorsi and the teres major in the lower part, lateral. Coracobrachialis. Musculocutaneous nerve in the upper part. Lateral root of median nerve in the upper part. Trunk of median nerve in lower part. Medial. 1 axillary vein. 2 medial cutaneous nerve of the forearm and ulnar nerve, between the axillary artery the axillary vein. 3 medial cutaneous nerve of arm, medial to the axillary vein. Branches. The axillary artery gives 6 branches. 1 branch arises from the first part, 2 branches from the second part, and 3 branches from the third part. These are as follows. Superior thoracic artery. Superior thoracic artery is a very small branch which arises from the first part of the axillary artery, near the subclavius. It runs downwards, forwards, and medially, passes between the 2 pectoral muscles, and ends by supplying these muscles and the thoracic wall. Thoracoacromial artery. Thoracoacromial artery is a branch from the second part of the axillary artery. It emerges at the upper border of the pectoralis minor, pierces the clavipectoral fascia, and soon divides into the following 4 terminal branches. The pectoral branch passes between the pectoral muscles, and supplies these muscles as well as the breast. The deltoid branch runs in the deltopectoral groove, along with the cephalic vein. The acromial branch crosses the coracoid process and ends by joining the anastomoses over the acromion. The clavicular branch runs supromedially deep to the pectoralis major, and supplies the sternoclavicular joint and subclavius. Lateral thoracic artery. Lateral thoracic artery is a branch of the second part of the axillary artery. It emerges at, and runs along, the lower border of the pectoralis minor in close relation with the anterior group of axillary lymph nodes. In females, the artery is large and gives off the lateral mammary branches to the breast. Anterior circumflex humeral artery. Anterior circumflex humeral artery is a small branch arising from the third part of the axillary artery, at the lower border of the subscapularis. It passes laterally in front of the intertubercular sulcus of the humerus, and anastomoses with the posterior circumflex humeral artery, to form an arterial circle round the surgical neck of the humerus. It gives off an ascending branch which runs in the intertubercular sulcus, and supplies the head of the humerus and shoulder joint. Posterior circumflex humeral artery. Posterior circumflex humeral artery is much larger than the anterior artery. It arises from the third part of the axillary artery at the lower border of the subscapularis. It runs backwards, accompanied by the axillary nerve, passes through the quadrangular intermuscular space, and ends by anastomosing with the anterior circumflex humeral artery around the surgical neck of the humerus. It supplies the shoulder joint, the deltoid, and the muscles bounding the quadrangular space. It gives off a descending branch which anastomoses with the ascending branch of the profunda brachii artery. Subscapular artery. Subscapular artery is the largest branch of the axillary artery, arising from its third part. It runs along the lower border of subscapularis to terminate near the inferior angel of scapula. It supplies the latissimus dorsi and the serratus anterior. It gives off a large branch, the circumflex scapular artery, which is larger than the continuation of the main artery. This branch passes through the triangular intermuscular space, winds round the lateral border of the scapula deep to the teres minor, and gives a branch to the subscapular fossa, and another branch to the infraspinous fossa, both of which take part in the anastomosis around the scapula. Anastomosis and collateral circulation. The branches of the axillary artery anastomose with one another and with branches derived from neighboring arteries, internal thoracic, intercostal, suprascapular, deep branch of transverse cervical, profunda brachii. When the axillary artery is blocked, a collateral circulation is established through the anastomosis around the scapula, which links the first part of the subclavian artery with the third part of the axillary artery, apart from communications with the posterior intercostal arteries. Axillary vein. The axillary vein is the continuation of the basilic vein. The axillary vein is joined by the venae comitants of the brachial artery a little above the lower border of the teres major. It lies on the medial side of the axillary artery. At the outer border of the first rib, it becomes the subclavian vein. In addition to the tributaries corresponding to the branches of the axillary artery, it receives the cephalic vein in its upper part. There is no axillary sheath around the vein, which is free to expand during times of increased blood flow. Axillary lymph nodes. The axillary lymph nodes are scattered in the fibrofatty tissue of the axilla. They are divided into 5 groups. 1. The nodes of the anterior, pectoral, group lie along the lateral thoracic vessels, i.e. along the lower border of the pectoralis minor. They receive lymph from the upper half of the anterior wall of the trunk, and from the major part of the breast, Fig 4.11. 2. The nodes of the posterior, scapular, group lie along the subscapular vessels, on the posterior fold of the axilla. They receive lymph from the posterior wall of the upper half of the trunk, and from the axillary tail of the breast. 3. The nodes of the lateral group lie along the upper part of the humerus, medial to the axillary vein. They receive lymph from the upper limb. 4. The nodes of the central group lie in the fat of the upper axilla. They receive lymph from the preceding groups and drain into the apical group. They receive some direct vessels from the floor of the axilla. The intercostobrachial nerve is closely related to them. 5. The nodes of the apical or infraclavicular group lie deep to the clavipectoral fascia, along the axillary vessels. They receive lymph from the central group, from the upper part of the breast, and from the thumb and its web. The lymphatics from the thumb accompany the cephalic vein. CL Cal anatomy. The axilla has abundant axillary hair. Infection of the hair follicles and sebaceous glands gives rise to boils which are common in this area. The axillary lymph nodes drain lymph not only from the upper limb but also from the breast and the anterior and posterior body walls above the level O1, the umbilicus. Therefore, infections or malignant growths in any part of their territory of drainage give rise to involvement or the axillary lymph nodes. Bimanual examination of these lymph nodes is, therefore, important in clinical practice. Left axillary nodes to be palpated by right hand. Right axillary nodes have to be palpated by left hand. An axillary abscess should be incised through the floor of the axilla, midway between the anterior and posterior axillary folds, and nearer to the medial wall in order to avoid injury to the main vessels running along the anterior, posterior, and lateral walls. Axillary arterial pulsations can be felt against the lower part of the lateral wall of the axilla. In order to check bleeding from the distal part of the limb, in injuries, operations, and amputations, the artery can be effectively compressed against the humerus in the lower part of the lateral wall of the axilla. Spinal nerve. Each spinal nerve is formed by union of dorsal root and ventral root. Dorsal root is sensory and is characterized by the presence of spinal or dorsal root ganglion and enters the dorsal horn and post-oral funiculus of spinal cord. Ventral root is motor, arises from anterior horns fillet of spinal cord. The motor and sensory fibers get united in the spinal nerve which divides into short dorsal ramus and long ventral ramus. Both the rami thus contain motor and sensory fibers. In addition, these also manage to obtain sympathetic fibers via gray ramus communicans. Only the ventral primary rami form plex uses. Brachial plexus is formed by ventral primary rami or ventral rami of C5, C6, C7, C8, and T1 segments of spinal cord. Brachial plexus. Dissection. After cleaning the branches of the axillary artery, proceed to clean the brachial plexus. It is formed by the ventral primary rami of the lower forecervical, C5, C8, and the first thoracic, T1, nerves. The first and second parts of the axillary artery are related to the cords, and third part is related to the branches of the plexus. Study the description of the brachial plexus before proceeding further. The plexus consists of roots, trunks, divisions, cords and branches. Roots. These are constituted by the anterior primary rami of spinal nerve C5, C6, C7, C8, and T1, with contributions from the anterior primary rami of C4 and T2, Fig 4.8. The origin of the plexus may shift by one segment either upward or downward, resulting in a prefixed or postfixed plexus respectively. In a prefixed plexus, the contribution by C4 is large and that from T2 is often absent. In a postfixed plexus, the contribution by T1 is large, T2 is always present, C4 is absent, and C5 is reduced in size. The roots join to form trunks as follows: trunks. Root C5 and C6 join to form the upper trunk. Root C7 forms the middle trunk. Root C8 and T1 join to form the lower trunk. Divisions of the trunks. Each trunk, 3 in number, divides into ventral and dorsal divisions, which ultimately supply the anterior and posterior aspects of the limb. These divisions join to form cords. Cords. The lateral cord is formed by the union of ventral divisions of the upper and middle trunks, 2 divisions. 2. The medial cord is formed by the ventral division of the lower trunk, 1 division. The posterior cord is formed by union of the dorsal divisions of all the 3 trunks, 3 divisions. Sympathetic innervation. 1. Sympathetic nerves for the upper limb are derived from spinal segments T2 to T6. Most of the vasoconstrictor fibers supplying the arteries emerge from segments T2 and T3. 2. The preganglionic fibers arise from lateral horn cells and emerge from the spinal cord through ventral nerve roots. 3. Passing through white rami communicans they reach the sympathetic chain. 4. They ascend within the chain and end in the middle cervical, inferior cervical, and the firet thoracic ganglion. 5 postganglionic fibers from middle cervical ganglion pass through gray rami comune icons to reach C5, C6 nerve roots. Postganglionic fibers from inferior cervical ganglion pass through gray rami comune icons to reach C7, C8 nerve roots. 7 postganglionic fibers from first thoracic sympathetic ganglion pass through gray rami comune icons to reach Th1 nerve roots. 8. The arteries of skeletal muscles are dilated by sympathetic activity. For the skin, however, these nerves are vasomotor, pseudomotor and pilomotor. Vasomotor constricts the arterioles of skin. Pseudomotor increases the sweat secretion. Pilomotor contracts the erector pilorum muscle to cause erection of the hair. Branches. The root's value of each branch is given in brackets. Branches of the root: 1 nerve to serratus anterior, long thoracic nerve, C5, C6, C7, 2 nerve to rhomboids, dorsal scapular nerve, 2 branches to longus colli and scalene muscles, both C5, C8, and branch to phrenic nerve, C4. Branches of the trunks. These arise only from the upper trunk, which gives 2 branches. Suprascapular nerve, C5, C6. Nerve to subclavius, C5, C6. Branches of the cords. Branches of lateral cord. Lateral pectoral nerve, C5, C7. Musculocutaneous nerve, C5, C7. Lateral root of median nerve, C5, C7, branches of medial cord. Medial pectoral nerve, C8, T1. Medial cutaneous nerve, C8, T1. Medial cutaneous nerve of forearm, C8, T1. 1 ulnar, C7, C8, T1. C7 fibers reach by a communicating branch from lateral root of median nerve. 2 medial root of median, C8, T1. Branches of posterior cord. Upper subscapular, C5, C6. Nerve to latissimus dorsi, thoracodorsal, C6, C7, C8. Lower subscapular, C5, C6, axillary, circumflex, C5, C6, radial nerve, C5, C8, T1. In addition to the branches of the brachial plexus, the upper limb is also supplied, near the trunk, by the supraclavicular branches of the cervical plexus, and by the intercostobrachial branch of the second intercostal nerve. Sympathetic nerves are distributed through the brachial plexus. The arrangement of the various nerves in the axilla was studied with the relations of the axillary artery. Clinical anatomy. Erb's paralysis. Site DF injury. One region of the upper trunk of the brachial plexus is called Erb's point, Fig. 4.15. 6 nerves meet here. Injury to the upper trunk causes Erb's paralysis. Katz's O/injury, undue separation of the head from the shoulder, which is commonly encountered in the following. Birth injury. Fall of the shoulder, during anaesthesia. Muscles paralyzed. Mainly biceps brachii, deltoid, brachialis, and brachioradialis. Partly supraspinatus, infraspinatus, and supinator. Deformity and position of the elbow. Arm, hangs by the side, it is adducted and medially rotated. Forearm extended and pronated. The deformity is known as policeman's tip hand or waiter's tip hand or porter's tip hand, Fig. 4.16. Dyssynergia, the following movements are lost. Abduction and lateral rotation of the arm at shoulder joint. Flexion and supination of the forearm, biceps, and supinator jerks are lost. Sensations are lost over a small area over the lower part of the deltoid. Klumpkus paralysis J3 jori, lower trunk of the brachial plexus. O/injury, undue abduction of the arm, as in clutching something with the hands after a fall from a height, or sometimes in birth injury. Nerve roots involved, mainly T1 and partly C8. Muscles paralyzed. Intrinsic muscles of the hand. Ulnar flexor of the wrist and fingers. Deformity and position of the hand. Claw hand due to the unopposed action of the long flexors and extensors of the fingers. In a claw hand there is hyperextension at the metacarpophalangeal joints and flexion at the interphalangeal joints. Disability, complete claw hand. Cutaneous anesthesia and analgesia in a narrow zone along the ulnar border of the forearm and hand. Horner's syndrome if T1 is injured proximal to white ramus communicans to first thoracic sympathetic ganglion. There is ptosis, meiosis, anhydrosis, anophthalmos, and loss of ciliospinal reflex may be associated. This is because of injury to sympathetic fibers to the head and neck that leave the spinal cord through nerve T1. Vasomotor changes, the skin area with sensory loss is warmer due to arteriolar dilation. It is also drier due to the absence of sweating as there is loss of sympathetic activity. Trophic changes, long-standing case of paralysis leads to dry and scaly skin. The nails crack easily with atrophy of the pulp of fingers. Injury to the nerve to serratus anterior, nerve of Bell. Causes: 1. Sudden pressure on the shoulder from above. 2. Carrying heavy load on the shoulder. Deformity, winging of the scapula, i.e. excessive prominence of the medial border of the scapula. Normally, the pull of the muscle keeps the medial border against the thoracic wall. Loss of pushing and punching actions. During attempts at pushing, there occurs winging of the scapula. Arm cannot be raised beyond 90 degrees, i.e. overhead abduction is not possible as it is performed by the serratus anterior muscle. Mnemonics: axillary artery branches slap the lawyer save patient, first part gives 1 branch, second part 2 branch, and third part 3 branches. Superior thoracic branch of 1 st part. Thoracoacromial branch of second part. Lateral thoracic branch of second part. Subscapular branch of third part. Anterior circumflex humeral branch of third part. Posterior circumflex humeral branch of third part. Thoracoacromial artery branches ABCD, acromial branches. Breast, pectoral, branches. Clavicular branches. Deltoid branches. Brachial circumflex branches. My aunt ragged my uncle. From lateral to medial, musculocutaneous. Axillary. Radial. Median. Ulnar. Roots, ventral rami, C5, C11. Trunks, upper, middle, lower. Divisions, 3 anterior and 3 posterior. Cords, lateral, posterior, medial. Nerves, branches. Stemoeponeurotic part of pectoralis major twist around the upper fibers of same muscle. Latissimus dorsi twists around the teres major. Thus the smooth anterior and posterior walls of the axilla are formed. Infraclavicular part of brachial plexus lies in the axilla. Apex of the axilla is known as cervicoaxillary canal and gives passage to axillary vessels and lower part of brachial plexus. Axillary sheath is derived from prevertebral fascia.